Let's call the name of our patient Joanne, who is a 23 years old lady that presented to the hospital with seizure. How did it happen? She is Joanne, she is single, she got pregnant. She decided to keep this pregnancy. However, the parents are not financially stable. The person that got her pregnant not financially stable. So antenatal care was not at its best. She continued the pregnancy until after 20 weeks, she developed high blood pressure. Because antenatal care was not at its best, maybe in a local facility where it was registered, nothing was done. She continued. They only came to the hospital after she started fitting. When she started fitting, she was brought to the hospital, and then they decided to examine her. The doctor discovered that she had preeclampsia. What would they do for her at this point? She's already fitting. When she's already fitting, it has progressed to eclampsia. In fact, they tried to bring out the baby. However, they lost the baby. She went into coma and was in coma for some days. Later, with prayers, according to the story, and the care from the doctors, the parents spent a fortune at that time. She was revived. However, the baby was lost. And today we'll be talking about preeclampsia. Good afternoon. Let's talk about preeclampsia. I made a post on social media, just a simple post about preeclampsia, and comments started loading in, people sharing their experience about this preeclampsia, and I'm like, what? Lots of people. In fact, we are losing plenty of women due to preeclampsia, and that's why I decided to make this video, so that we are aware, learn, and prevent it. Okay, what is preeclampsia? Preeclampsia, it's a medical emergency that occurs in pregnancy after 20 weeks. That is to say, when your pregnancy reaches 20 weeks, at this point, you begin to monitor for this or look out for this, especially if you have the risk. I'm going to tell you the risks of the people that are at risk of getting preeclampsia. This is because the cause of preeclampsia is not known. However, if someone's risk is high, you have to monitor this person especially. Someone wrote on social media, he said, it almost killed me. In fact, she had full-blown eclampsia. She had seizure. She was temporarily blind. It shocked you, right? And then some people come down with kidney issues, kidney failure, because of preeclampsia. Preeclampsia occurs after 20 weeks in pregnancy, high blood pressure, protein in urine, and sometimes body swelling. Now, these are things your midwife should know. Of course, they should know. Your doctor should know. However, you as a patient, you need to be educated on this. And this is why I'm making this video. What are the signs of preeclampsia? They can present with headache. When you are in 20 weeks and above in pregnancy, and then you are having headache, please do not ignore. It can come with blurred vision. In fact, the person that wrote on social media had temporal blindness, and it is temporary because it can be treated, like it was treated, right? But if it's not properly managed, it can be complications. So you can have blurred vision, there can be nausea, vomiting, there can be abdominal pain, especially on the right side of the abdomen, because preeclampsia affects the liver as well. Do you get it? And so when it progresses, it can affect urine output. So these are the signs and symptoms of preeclampsia. Now, if it progresses to the chairman, which is eclampsia, the person can go into coma. In fact, I know someone that went into coma and was in coma for some days. I will tell you the story in my next or in another video, hopefully. Okay, it can be, person can present with seizure, and sometimes they may lose the baby or lose the pregnancy. This is where, when you are not able to manage it, and then the treatment basically is to deliver the baby. So they tend to deliver the baby as soon as possible. However, if it is managed, you can take your baby to full term. Okay, what are those at risk of getting preeclampsia? A young lady less than 18 years that is pregnant, first pregnancy, or someone greater than 30 years and then being pregnant. And then if you have less than 2 years or more than 10 years, space or spacing for your children, there is risk of having preeclampsia. Another important risk factor is family history. If someone in your family, your sister got preeclampsia, or yourself, you had previous history of what preeclampsia. Funny enough, a book said change of husband. That is to say, you had a baby for this man and then had a baby for another man. There's another increased risk of what? Preeclampsia. Now, what do you do? Can it be prevented? Yes, it can be prevented. First of all, you need to register your antenatal on time. 2, if you're at risk, I would advise let your pregnancy be monitored or be taken care of by a specialist, a gynecologist, an obstetrician. They will take care of you. Now, your doctor will examine you and depending on your risk, may give you some medication to prevent it. Okay? And if you have some of these symptoms that I have listed, please go see your doctor. Preeclampsia is on the rise. In fact, there was a lady that even passed recently, and it's all over social media. The lady that the husband could not provide money for her to be managed. According to the husband, she had seizure. She was fitting. So you see that it is becoming rampant and it's becoming very common. If people do not share their story, you will not know that people are passing or dying because of preeclampsia. Please do well to share this video. I hope you've learned something. We learned about the symptoms of preeclampsia. We learned about hypertension in pregnancy, protein in urine. You can have leg swelling. And some people can have puffy face. That's part of the body swelling. And then some people, those that wear ring, you see that the ring will not be able to come out. So if you wear ring, like if you wear ring and you're pregnant and your body is swelling, please remove that ring so that you do not get to a point where you may have to break the ring or something because your body is swelling. I hope you learned something. Leave me a comment in the comment section. Tell me, have you experienced this a preeclampsia before during pregnancy? Have you seen someone that experienced it? And do well to subscribe, give us a like, and I will see you in my next video. Bye. I remain Dr. Chidima, and thank you so much to all our new subscribers. You're welcome. Bye bye.